So Nick Gitsham, you are the head of social prescribing for NHS England and Improvement. We're honoured to have you here, and it's also exciting that you have the background as an occupational therapist. So that's a wonderful, I think, a wonderful background to this kind of area. So first of all, Nick, I wonder whether you just kick off with defining social prescribing for us. What is it, and what does it aim to do?
Thanks, Olivia, and it's brilliant to be here today, and it's lovely to look at everybody that's signed up, including some link workers and social prescribing services. So social prescribing is a way for health professionals, including link workers based in GP practices, to connect people to community activities and support. So it's based on what matters to the person, and it helps connect people up with practical, emotional and social support. It's part of personalised care, which is one of the 5 key themes and practical changes that all health and care systems have to make by 23-24. So part of the long-term plan, and there's some specific targets related to social prescribing and the rollout of social prescribing link workers in primary care across the country by 23-24. Is it helpful to say a little bit about what a link worker does? Because I think that's perhaps useful in this context.
Yeah, just if you could just give a 1 or 2 sentence summary, that would be really helpful. Thank you, Nick.
Yeah, so social prescribing link workers, I mean, this is part of a huge change within transforming the NHS to deliver, to not just deliver medical care, but to deliver personalised biopsychosocial approaches, and to really sort of start with what matters to the person, taking a much more holistic view of their health. So looking at the biopsychosocial approach, really tackling underlying issues, social determinants of health that are affecting people's health. So like you talked about with prevention, and connecting people up to practical emotional support in the community, the arts, nature, which is what we're talking about today, and exercise. And I think what social prescribing does is it really helps people to get their sense of agency, sense of purpose, the reason for getting up in the morning, and connection to community. And what we often find is that when people have experienced social prescribing, they then want to contribute to their community as well. So they become part of the solution and bring their assets and what they bring as individuals to transforming local communities.
Oh, fantastic. So it's sort of a cycle of flourishing there. That's really exciting. Thank you. Brilliant. Well, that's a great introduction. So just to make sure I'm clear, so green prescribing really sits under that umbrella of social prescribing and sort of linked up with sort of nature-based therapies, essentially. Is that what you're saying?
Yeah. So green social prescribing is supporting people to connect with nature-based activities. Social prescribing is going to look at the holistic needs. So it may also be connecting people up to, say, practical and emotional support to do with debt or housing or underlying issues that are affecting people's health. Could be connecting them up to the arts, could be connecting them up to exercise. But one of the exciting things we're seeing about green social prescribing is when all those things come together. So we see artists collaborating with green providers, and we find exercise connecting with nature, such as walking groups, bushcraft, all sorts of things. So there's a huge range of activities. Green activities can be from local walking groups, being a conservation volunteer, care farms and opportunities around employment, community gardens, green gyms, all sorts of things coming together. So it needs a wide range of green prescriptions or green activities in a local area, and making sure that they're inclusive for people that may get left out. So really making sure it works for people in inclusion groups, people from BAME communities, and people with learning disabilities and autism, and working with people to develop those offers. And then for link workers to connect people up, but it could also be other professionals in health pathways, such as occupational therapists or mental health nurses, if people start to understand how to have that what matters to you conversation and connect people up to what's available locally.
Fantastic. Thank you, Nick. I can see your enthusiasm and joy for this this area. That's really exciting. What a great start. Thank you very much.
We have, I think, not just to improve health and well-being of the nation, particularly people who are most at risk of health inequalities, but also to build not just resilient, sustainable communities, but places where give us all reasons to get up in the morning for everybody. And I think purpose and connection is just so key here.
It's so important. Lovely. Thank you, Nick. That's